Hey class, Dr. Doug Brown here. Hope you're having a great weekend, getting cranked off on a Monday morning if you're watching the video on Monday. We had a great week, great start to the class. Thank you for working hard in the discussions and the related assignments. Last week, along with our introductions, taking a look at the syllabus and the requirements of the class. We also had a good discussion about infectious agents and public health programs. We took a look at some of the agents out there that affect us, as well as some of the public health programs in Massachusetts and our own state. If you don't live in Massachusetts, hopefully you were able to take a look at the public health programs in your own state or surrounding areas. Thank you for doing such a good job in the discussion. You gave it your all, gave 110% into sharing a great initial post and replying to your peers. So thank you for going the extra mile. Great discussions, off to a great start, and I'm proud of each one of you. I'm excited about this class. We have some exciting, excellent students in the class. All of you have a great background and dealing with something emergency related, or you have a passion for working in this business. So I'm sure it's going to be a great class. So hopefully you'll expand upon your experiences, share some of the things that you've done in the past, or some of your thoughts, things you've worked on, or things that you think should be addressed as we move forward into discussions. Please feel free to share those. So what are we doing this week? We're going to discuss emerging and re-emerging infectious diseases. So we see a lot of diseases, some of those different things that are out there. We'll talk about climate change too and diseases, but we look at some of those things that we've not seen in a while this week, or some diseases we're not familiar with. In the last couple of years, since 2014-15, the United States has actually had patients arrive here with Ebola, something we've not had here. It's not been an issue in the United States unless a passenger came in from outside in the country, in a region, the Congo or some other region that's affected by Ebola outbreaks. We've not really had an issue here, and so those patients came for treatment, and it was a very controlled environment. Many of the emergency medical services and the fire departments actually developed plans for Ebola response, outfitted ambulances, etc. Should a patient arrive and have to be treated here, or a patient arrived unexpectedly. Some of the other things that we're seeing, again, building upon what we talked about last week with vaccines, is the outbreak of measles, mumps as well, but especially measles. It seems that we're not getting those vaccines like we used to, and so we're seeing this reemergence of some of the disease processes and outbreaks, infectious diseases we've not seen before, such as measles among children, and then sometimes the elderly. So when you take a look at the assignment this week and you write your papers, consider thinking about some of those things that we've not seen. Just really thinking outside of the box, and some of those are pretty constant, whether they're endemic to an area, or we've had an outbreak that we're not familiar with. I haven't seen in a while, such as measles. The flu happens all the time. That's something that we're pretty familiar with. A few years ago, we had an outbreak of monkeypox, as I mentioned, I think in my last video, from prairie dogs. And so those are some of the diseases to consider that without intervention of public health, the CDC, the state health agencies, etc., we obviously could have a problem, because it wouldn't take very much at all for that to spread to the rest of the population. So that is something to consider when you take a look at those. In our discussion this week, we're really looking at climate change and disease. There's a lot of scientists out there that support the theory that the climate is changing due to the intervention of humans, or industrialized plants, the output, the carbon footprint that we have, So the environment's changing. Now, whether or not that's, some say it's supported by science, others say it's not, but definitely we are seeing a change. For whatever reason, we're seeing a change. The polar ice caps, those are melting. There's less ice. There's more water. There's talk about some communities actually having to be moved, relocated, evacuated in the next decade, if not sooner, because of rising sea levels. Places like New Orleans, and of course places overseas, potentially could have to evacuate and have to relocate because their communities may not be there. So something's going on, and we know there's going to be some changes in the next decade, and that's something that the public health officials will have to certainly consider, as well as emergency management. But what about disease outbreaks in that? In our discussion, think about some of the diseases we've not seen before that could occur because of climate change. If the earth is warming, as a lot of scientists believe, then some of those threats that we don't have here in other regions possibly will emerge, and in some cases reemerge. So we're seeing that in Massachusetts now with encephalitis. We certainly could see that with more outbreaks of West Nile, and there's a lot to consider there when we look at climate change and those disease processes, because as it warms, those warmer regions such as in Africa, Central America, if the United States warms away that those areas of the world are now, some of those diseases that they have that we don't have here, we may see, and we're likely to see. So just consider that in the discussion this week. So two of our questions this week that we have: if climate change continues, will it cause an increase in emerging diseases or create new unknown diseases as part of an evolutionary process? And that may be unknown. There may be some unknowns out there, things that we're not familiar with, that we've not seen before, and we don't even know how to treat it because of climate change, but by the warming of the earth as those things occur in the population. There may be a superbug created that would cause a pandemic. What is the possibility of a pandemic in the near or far future, in your opinion? And then if you have data, please provide that. One of the things I want you to think about when we talk about pandemics and we look at diseases, emerging diseases, those that reemerge, syndromic surveillance. And if you remember the flu outbreak, the pandemic that occurred 2008 to 10, we used syndromic surveillance in some of the processes we did by looking at data. We looked at that flu data. As a matter of fact, that's somehow that we learned about the pandemic is using syndromic surveillance when people in Mexico started having outbreaks of this unknown flu. And so as it grew, the United States, the CDC, World Health Organization took action and started to combat this by trying to make sure we had people vaccinated for the current strain of flu, and then develop a vaccine for this emerging threat. And so I think that probably reduced the number of deaths, certainly infections that we had, and likely would on emerging diseases if the syndromic surveillance network works fine. So how does that work? When the data starts coming in, the information is pushed out daily from different labs. Once they start seeing some of those different outbreaks or emergent infectious disease, that gets out through the network to the different labs, the CDC, the other governments, the WHO, etc. And then, excuse me, at that point they have to make a decision about whether or not they're going to take action or they're going to wait and see. And so what's happened in the past is they fired the gun, so to speak, and took action ahead of time in an effort to head off some of those outbreaks and to prevent the pandemic or lessen the impact, to mitigate it, if you will. And so that's likely what's going to happen if we start seeing an outbreak. Now, there's other biosystems. You hear about some of the chickens on the border, along the Canadian-U.S. border, the Mexican border, those sort of things that we have. Some of those systems in place where they're checked, different birds, because a lot of times an outbreak will spread to those birds, or maybe that's where it's going to start before it's transmitted to humans, or the virus will adapt to humans. So it will happen there. So once those biodefenses that are in place, along with the other systems for syndromic surveillance, by checking those emergent threats from those different labs through the network, we're able to identify potential outbreaks, infectious diseases, and then hopefully ward those off by taking some action and developing a vaccine or using what we have now to address the concern. And so there's a lot of public health officials out there. There's a briefing that comes out daily. Some of those briefings you can sign up for with your state health agency, so you might take a look at that. And so you can have some idea. Now, Google flu and some of those that were in place before aren't there now, but those bio labs, some of those labs in the network still utilize that data and then push it out to those that need it. And then the public health experts, epidemiologists, etc., make the decisions, like I said, about what action they need to take, if any, related to a potential outbreak. So just consider those in your discussion this week. So think outside the box on notes. Think about some of those emerging threats or things that could emerge, or things that we don't know about. Maybe there's a little information out there when you search for it. Think about those things that we could potentially be affected by here in the United States when doing your discussions and your written assignment this week. And make sure that you post your initial post by Wednesday. Connect with 2 or more of your peers by Sunday, earlier if you want, and then post your assignments by Wednesday by Sunday as well, your written assignment as well. Make sure you look at the instructions real closely and follow the APA. Check your grammar. Make sure that you cite your sources, include those sources in there if you don't mind. Just remember on APA that we post, we share the citation before the period, not after, and then we just share author, year, and then list of references. Just give you a little bit of practice on your writing in APA as we move along. Obviously, that's important. However, addressing the material in the discussion and the written assignment is the most important thing. So that's about it. It's been about 13 minutes, and thank you for all your hard work. I'll see you in the discussions, and if you need me, feel free to reach out, and I'll do everything I can to help you. I look forward to a great discussion this week.